And hi guys. So I'm gonna wait for you to pop back in. I'm going live. Hi Shiva. Okay, so let me just do a quick introduction again. So I'm interviewing Dr. Nora. She is a naturopathic medicine doctor. Her specialty is gut health and metabolism. So if you have any questions regarding different diets, regarding your metabolism, you can send the questions here. I am holding a women's circle starting February 1st. It's 5 weeks on Monday nights. I have invited 5 different amazing women. So I have to guide Dr. Nora to join us. So the women's circle starts February 1st on Monday nights. Oh, I think she just joined us. Yay! Okay, I'll just do a quick introduction again. So the women's circle, I have invited 5 different women, 5 professional women. So the first week we had Salehi, she's a neuroscientist, and then we had Bahareh Hosseini, she's a herbologist and acupuncturist. And today it's my pleasure to invite and introduce Dr. Nora. She's a naturopathic medicine specializing in gut health and metabolism. So she will be with us on February 22nd. It's the 3rd Monday, I think, or 3rd or 4th Monday of the month. And without further ado, here is Dr. Nora. Dr. Nora! So I'm waiting for a response from Dr. Nora. Yes!
Success.
Amazing.
Apologize for the
Technology.
Yes. Okay, I have to stabilize here. Okay.
Yeah.
Nice to meet you.
Stabilize your phone.
Yeah. My name is Dr. Nora Naturopath. I'm a naturopathic doctor at Toronto Metabolic Clinic. I'm also one of the co-founding partners here. The clinic's focus is metabolic disorders like diabetes and weight loss and prediabetes, polycystic ovarian, and sort of all of those metabolic issues that a lot of people have. I do also focus on digestive health, which is what my topic is with the Women's Circle. I guess Dory wanted me to say something interesting, and she.
Oh, I'll ask you a couple questions. So just
Okay.
tell us, so tell us where did you go to school? Where did you study?
Yeah.
And then, yeah.
So.
Just the background.
Sure. Okay. So I went to the Canadian College of Naturopathic Medicine, which is here locally here in Toronto. It's one of.
Was that 5 years?
It's a 4-year program.
4-year.
Yep. It's one of the only, there's only 2 schools in Canada that are sort of certified or credible for sort of having this degree. And it's a post university. So you have to graduate with a bachelor degree first, and then you can sort of go into this program. Mm-hmm. And so I've been in practice for now. It's 5 years now, and been a very fun 5 years. I'm very passionate about naturopathic medicine, so I'm happy to be doing what I'm doing, and I see the benefits the patients get from, using natural medicine. It's, there's a time and a place for both conventional and natural medicine, and I think the best way is when you combine the two. So you should.
Yeah. Mm-hmm. So Dr. Nora, she was with us for the past 3 women's circles?
2, I think, actually.
2? Okay.
Yeah.
So, and different topic. We didn't talk about gut health, and we were just talking about healthier living or different types of removing bad habits and things like that. And then somehow the conversation would always go towards like healthy food and gut health and like metabolism. So it was just like, you know what, let's have that topic because people have lots of questions. There's a lot of different things, schools of thoughts that are happening, but I think it has really to do with individuals and
Mhm.
how they feel in their body in terms of the food that they eat.
Yeah.
But if you have like a general idea of what types of food we'd have to avoid for a more vital energy and what types of food we have to like eat more of, uh, give us that idea, like a general idea.
So with regards to what types of foods to eat, obviously, I mean, the sugars are not that beneficial for us, whether it be like a healthy coconut sugar or white sugar. I think anything in excess, if you have the habit of always eating sweet stuff, even if it's a 0-calorie sweetener alternative, right? Like a stevia or xylitol or any of the monk fruit. Now research is showing that does impact your gut microbiome with regards to artificial and natural sweeteners. So when we're talking about gut health, I think like even those in that aspect, you probably don't want to be consuming excessively sweet tasting food. Just if a food is naturally sweet, like for example, sweet potato, that's a good source of like vitamins and minerals, and there are some carbs in it, but you want to have basically a good balance with a lot of vegetables, fruits, a good source of protein, whether that be a vegetarian source or a meat source. But if you think about also pesticides that sort of contaminates our food, if you have, if you look into sort of the environmental working group, they have a nice list they've compiled of food produce that they've sort of measured the amount of pesticide that sort of is in a lot of the produce, and they've rated which one has the most pesticide, which one has the least pesticide. So if you were to like spend your money on organic, you'd want to you would want to sort of invest into the vegetables and fruits that are sprayed the most, things like strawberries and
Sprayed the least or the most? What do
sprayed
you
the
mean?
most. So for those, you want to buy organic. For the things that are not sprayed as much, you don't need to bother spending your money on organic, right?
Ah, okay. I got it.
Yeah, so like strawberries are sprayed a lot, so you probably want to buy strawberries organic,
Okay.
or not buy them at all. um,
Oh,
Spinach is also on the list. After that would be kale and nectarines and apples and grapes, and peaches, cherries, pears, tomatoes. Those are
these
sort of
are these are what's we want to buy organic.
exactly.
Ah, okay.
They have high levels of pesticides, and you know, obviously pesticide, we can try to wash it off, but I don't feel that it's very effective, to be honest.
Mhm.
And it's shown to have a lot of negative health impacts when you consume excessive.
Carcinogenic, yeah.
Yeah, so um, I guess the body burden of that you want to reduce. And there are other things like, for example, things that are high mercury, like tuna, like the big fish, tuna, sharks, lobsters, those tend to have high levels of mercury. So if you sort of repeatedly consume these things, it will show up, actually, it will even show up in your blood work that you have high levels of mercury.
Oh.
So um,
Okay.
you have to be.
So going back to the fruit thing.
Mhm.
So basically the fruits that have like a very thin skin and are juicier, then those ones we need to go towards more organic.
Yeah, yeah. For example,
But
like
if it But if we got an avocado,
Yeah, exactly.
then that is okay to get the non-organic.
Exactly.
Okay,
Exactly.
because it has like a protective, like with the pesticide, it doesn't really seep into the meat of the fruit.
Well, avocados naturally have like a thick skin, so the likelihood of bugs sort of killing or ruining the fruit is less likely. So they don't need to spray it as much because it has that natural.
Oh, okay, okay, okay.
So they're not gonna spend their money spraying it if it's already
Oh, makes sense.
not. And pineapple too. Like pineapple is one of
Oh,
them,
yeah, yeah.
and it has natural like enzymes that are protective as well. And yeah.
Pineapples I heard are good for like digestion, like to eat it after dinner or after big meal. Is that true?
It's probably the bromelain that you're thinking. That's the enzymes. It
Yeah.
That's not so much present in the fruit part of it. So um,
Oh,
the fruit is very juicy, sweet. So I would say there's a lot of sugar in the pineapple, but the
okay.
bromelain is, I think, primarily extracted from the leaf, if I'm not mistaken.
Mm. Oh, okay, okay, okay. Cool,
Yeah.
cool, cool.
So unless
And
you're eating,
sorry, so I cut you off about the fish and the stuff. So, like, what if I purchase, not farmed, like Atlantic salmon? Like,
yeah, I
is
mean,
that better or?
my philosophy is always, uh, eating a colorful diet. So if you are always eating broccoli day in and day out for every meal, I mean, you might even develop sensitivities to that.
Yeah.
So you want to vary up whatever you're eating because broccoli will have good nutrients, but it's the nutrients. So a wide variety of vitamins and minerals. You need to have a wide variety of sources. So
Mm.
you want to sort of change it up, whatever you're eating. So also it keeps it fresh and you won't get sort of tired of eating the same
I
thing.
don't.
Some people are more picky about that, others are, they don't really care.
Mm.
But I think you're more likely to run into some deficiencies if you are always eating the same thing.
Okay. So
As far as,
colorful variety.
yeah, that includes protein sources. Like, so if you're eating fish every day, I mean, I think salmon is relatively lower with mercury content, but if you have it every single day, it's still seafood. Like it will still have some contaminants, even
Yeah.
though it's wild caught, even though like, ideally, if our environment wasn't so polluted, it would be fine. But
Hmm.
I mean, there are sort of Inuit villages or cultures that their predominant diet is seafood. So, it's not necessarily a bad thing. I just think we have so much variety in our supermarkets. Why not use that?
Yeah. So, um, in the last women's circle, I know you went over some of the stuff that we can. It's good to buy organic. So that's you introduced it as for people that want to go and search it on Google themselves. So it's like dirty dozen,
Oh, clean
clean.
15, yeah, clean 15, dirty dozen.
Oh, clean 15, dirty dozen. So that
Yeah,
tells you 15 things that are clean that you could purchase
yeah,
and 12 things that are better if you purchase them in organic.
yes, yeah,
Okay.
exactly.
Clean 15, dirty dozen.
That's through the environmental working group. They have a
Environmental
complete
working.
list where they actually rate them from top to bottom. But
Oh,
for
okay.
simplifications, they've made a short list.
Of course, our attention span so
Yeah,
so it's like 12 and 15. That's all I can take.
yeah, yeah.
Okay, so that's something people can go and Google on themselves. Um, Another thing is that your practice, you're seeing people online now.
I do still see people in person and also
Oh,
online.
okay.
So
Okay. And
restriction
your practice is on Shepherd and Consumers Road.
Correct.
Right? Yeah, okay. So for people that want to know, and it's called, what is it called?
Toronto Metabolic Clinic.
Toronto Metabolic Clinic. Okay, awesome. So for our women's circle, which for you I think is going to be February 22nd, but I'll send out a poster with every date and every all of our professional ladies. So just go over like an overview of what you're going to talk to us about. I know it's gut health, but like you're going to talk to us about diet. What are you going to talk to us about?
So gut health is so important because if you have sort of issues with digestion, then that can impact so many things within your body. It can impact your skin, it can impact your joints, it can impact, whether you feel like fatigued or headache, because the digestion is like the primary place where you're absorbing all your nutrients. Of course, like it's all important what you're eating, but also how your digestion is functioning is important on how you're absorbing the nutrients that you're eating. You may have a very clean diet, but if you have a microbial imbalance and you have a lot of inflammation within the gut health, then that can cause a lot of something called leaky gut. And so, and it can impact, your nutrients, overall nutrients. And I've seen vitamin B12 deficiencies, iron deficiencies, because of certain organisms that sometimes affect your stomach, impacting your stomach acidity. So I'm going to be talking, I guess, about, yes, food, but also how your gut functions and what you think is not related to gut health is actually related to gut health. Like a lot of people, when they improve their digestive function, all of a sudden they're not getting any more headaches. Their eczema and dry skin improves. Their joint pain is improved. They can go up and down the stairs and do all sorts of yoga moves.
Yeah, their energy lifts, like their vitality changes. Yeah,
exactly. So, and that's just by working on a gut health. So it goes to show like the importance of it. Of course, like a lot of these issues can be, related to other things, but if there is concomitant digestive issues, then usually that's the place you start.
There's always correlation with the gut.
Yeah, exactly.
Awesome. Okay, so again, if you guys have any questions for Dr. Nora, please send them my way. I will share with her and we'll talk during our circle, answer those questions. Again, thank you so much. This was an awesome, just a short snippet of what you're going to talk to us about on the circle. And we have a bunch of people already signed up, so it's on Zoom. So we can have, I guess, as many as we want. Before we had a limit of 8 women, but now we don't have that limit. So
great.
Whoever wants to join us, you're welcome.
Thank you, Dory. I appreciate it.
Thank you so much, Dr. Nora. Cheers. We'll see you in a month.
Bye.
Bye. Alrighty, guys. So you can visit my website. It's Pro Yoga Live and www.proyogalive.com. That's where you can register for the Women's Circle. So far, we have an amazing lineup of women. So next stop, next live, I think it'll be with Candice West. And she is a registered massage therapist. She specializes in the manipulation of the body and how we feel physically. And she's going to talk to us about sex. And then after that, we have one more lady, Becky. She's a spiritual guide, and her sessions are always packed. But for her, we do have a limit between. I'll see if it's between a maximum 6 and 8 people. So if you are joining us, make sure you let me know if you want to be in Becky's session as well. So I'll send out a poster so you can see a little bit more. Much love. I'll see you later. Have a good weekend.